The Kacumbala Health Centre III upgrade to Health Centre IV is being undertaken by Uganda People's Defence Forces Engineers Brigade, a vital lifeline for the local community in Bukedea district. As the construction nears its final stages, the upgraded Health Centre IV will be vital in providing comprehensive healthcare services to thousands in Bukedea district.
Okay, I'm Dr. Kiai Caroline Otede, the in-charge Kacumbala Health Centre III, which is being upgraded to Kacumbala Health Centre IV. We want to thank the Updf Engineering Brigade for having taken up the project of construction to help in the upgrade of Kacumbala Health Centre III to Health Centre IV, which is now nearing completion. It is at 85%. This construction will be of a great boost to our current service delivery. We have an average OPD attendance per month of 1,500 patients and an average delivery per month of 150 mothers. Of those mothers, we have referrals out. So with this new building and the new constructions, we shall be able to have other deliveries, more deliveries and more mothers in the facility. And also we shall be able to improve, to have other services like inpatient services. Previously, we are not admitting because we don't have wards. In the current project, they've given us the general ward. We shall be able to improve on our services, the patients that we refer out for admission. And also we have an operational theatre. So for emergency obstetric care and gynecological care, we shall be able to utilize our theatre when it's completed.
In the heart of Bukedea district, this new upgraded facility shines bright.
I am Captain Noah Opio. I am the project manager of projects under ministries, departments and agencies in Eastern Region under UPDF Engineers Brigade. So I oversee the constructions that are undertaken by UPDF, as I mentioned above, from Eastern, from Jinja up to Karamoja side, that region within Eastern Region, all that area I am the one overseeing. So today here we are at...
Before we go for today's site,
yes.
How many districts are you in charge? And what are the projects within the scope?
All the districts.
No, just give us that.
No, so far we are doing projects in Kawolo Hospital. I oversee. Jinja Referral Hospital. We have done an oxygen plant, and we are also fencing that hospital. Wall fencing the general hospital. That's in Jinja. We have projects in Kamuli district. We are doing fencing and maternity ward. We have done there. You come to Namutumba. We are doing work there. We have renovated the facility. We are doing theaters in Bukedea Health Centre III and in Size, including the doctors' quarters. Namayingo, we are also doing a maternity ward. So those are all in Eastern Region. When you come to Mbale, we have done some work in Mbale City. We had a maternity ward at Bufumbo Health Centre III. We are also doing work with Namisindwa. We have a theater. And then that is Bumbo Health Centre III. We are also doing a maternity ward at Bukedea Health Centre III, that is in Bukedea. So when you cross to this side, Palisa, we have done work. We have renovated doctor's quarters. We have built a laboratory. We have also renovated about 4 health centers in Palisa. That is Gogonyo Health Centre III. There is Kacumbala Health Centre III. There is Mpongi Health Centre III, and the Agule Health Centre III. So all those works we have been undertaking in Palisa district. But as you leave Palisa, we also can take you closer to Palisa. There is Bukedea. We are also doing work in Bukedea. There is a lot of activity there. It involves the like this facility, maternity ward, theater, general ward, doctor's quarters, all that we are doing in Bukedea. And then when you come here, this project we are in now is operationalization of Kacumbala Health Centre III into Health Centre IV, where the project is estimated to take 18 months. But we have already spent beyond that. We have requested for an extension of up to October this year. We shall be done with works here.
This is Kacumbala Health Centre III, where transformation is taking place.
Here the scope of works is a general ward, which is just behind us here. And then there is a maternity ward, there is a theater, there is doctor's quarters. We are also putting up a staff house. We have a 4-stands pit latrine, a theater, and other external works. As you look at this side, we are supposed to renovate this side of the old structures are all supposed to be renovated. We are supposed to do the compound, working on paving the compound. We are going to do solar installations, and so far we are at 84%. And the total cost of the project is estimated to take 1.76 billion Uganda shillings. That's the far we are as per Kacumbala Health Centre III is concerned. So this was a bush. This area, we only the other hospital was a small hospital was on the other side, the Health Centre III. But when we came now, we had to clear these areas, you see. And then we started from scratch to put up the infrastructure you're seeing.
What does it mean for the community of this area? And how big is this infrastructure?
Well, these people have been having a challenge of accessing better medical care facilities. So the nearest have been in Bale and Kumi. But now, by upgrading this Health Centre IV, it's going to help this community reduce the walking distance to access doctors. As you know that Health Centre IVs will have a resident doctor where they can even conduct operations. Like now you're seeing we are putting up a theater here. There is a maternity ward. So all the basic operations, they don't need to move long distances. So this community is going to benefit from this facility so much.
The Uganda People's Defence Forces Engineers Brigade has been upgrading this vital healthcare facility to a Health Centre IV, and we are here to take a look.
Now this works, our client is Ministry of Health, but the project is being supervised by the district engineer of Bukedea district for quality assurance. We have been working with them closely. They have been very cooperative. The administration of this hospital, the in charge, they have all been very cooperative. That's why we have been able to achieve this milestone you're seeing. Now we have been working together. We have been ensuring, supporting the staff on ground to ensure that they access materials with quality assurance. We get our materials from factories, like cement we get from Toro Cement and Hima. We buy steel products from Roofings Uganda Limited. So we make sure that our staff get materials on time, and even the local materials we mobilize from sources which have been tested and approved from the laboratories and confirm that those materials are fit for use in the site. We are so proud to serve our country. First of all, we appreciate the President of Uganda for his wisdom in ensuring that at least let the army participate in ensuring we deliver quality medical facilities across the country. Because before there was contractors doing these works, but the quality of the products has not been as good as the army now, because our interest is not, we are not profit oriented. Our salaries, our allowances have been enhanced, so there is no reason for us to do shoddy work. We are emphasizing on quality work, quality and time saving, and the costs have also come down. We are not paying taxes, so we are not interested in profit. So the cost of this facility, if it was in a contractor, would be far over 3 billion, but we are doing it at just 1.7. So that alone is good for us.
With precision and dedication, Engineers Brigade have worked tirelessly to complete this facility in a agreed timeline with the client, the Minister of Health.
Also, we have other patients that have been referred out, especially the mothers. Now, with the theatre being present, we know our deliveries will increase, and also the number of patients the facility will be serving will be high. We want to thank the Engineering Brigade once more. Their presence has created a sense of security in the place. Our facility is not fenced, and we have been having a lot of cases of insecurity around. From the time they have been on ground, they have provided us with security, and then they have been the best. The working relationship with the community has been the best. You actually can know that they are from the Updf. They have blended so well with the civilian population, and we want to thank them for the good discipline, the good work. We have not had cases of theft, maybe from site and materials. So they have done the best work and the best relationship we have ever witnessed from UPDF ever. We want to thank the NRM government for thinking of the people of Kacumbala by providing us a health center for improvement of service delivery.
Kacumbala Health Centre III upgrade is part of the government's effort to improve healthcare services in the country.
Materials are taken to their material laboratories. Like here in Mbale we have one. So before we use a material, we sample the materials. Like we go to a quarry, for example, sand. We take it to the lab, and if the compressive strength of the material has been verified, it's within it passes the test, then we bring it to use. But for industrial materials, those materials are already certified by ISO, they are certified by Uganda Bureau of Standards. So those ones, we don't test them. The assurance is already there for industrial materials. But what we are interested in local materials, we make sure we take them to the laboratory first.
The new facility will provide enhanced medical care services to the community of Bukedea, includes maternal, intensive care, and emergency services.
We are very sure, and we are not going to let the president down, because he gave us the mandate, he has motivated us, he has added our allowances, and there is no reason for us to do shoddy work. I can assure you that with years to come, this building will still remain here. And you can compare it, in the next 10 years, you see the building will look new as it is.
The new Health Centre 4 will be equipped with modern medical equipment and staffed by trained healthcare staff. Upon completion, the facility will be a game changer for Bukedea district and neighboring districts.
Well, first of all, before we start any project, we mobilize the communities. We educate them about the importance of the project to them. And those communities, we request them to give us some of the qualified personnel and even those who are not qualified, and they join us and work with us. So, first of all, they benefit from the project, they earn something from it. And then secondly, they have that belonging that this is our project, we are constructing it. We have also employed even girls. We are gender sensitive about the workforce we are having here. Because before we used not to have girls engaged in construction works. But when we requested these communities to give us the energetic young people, we were happy to note that even girls were involved. And the community has benefited from this project, and they own the project as their own.
The community in Kacumbala in Bukedea district relies on this Health Centre 4 for vital medical care services. It's essential that Uganda People's Defence Forces Engineers Brigade complete this facility to serve them better.
We get patients from Sironko, and then because we are bordering in Mbale, so some patients from across Amus, after Amus they cross over to Kacumbala. And then largely we cover Bukedea district.
Bukedea, we have this, specifically this one, and there is another Health Centre 3 called Health Centre 3. We are also going to put up maternity ward. It was a project started by Honorable Speaker. You should be informed that the Speaker comes from this area. So she had started a maternity ward in this area. The health center college is down this side. That road you see takes us up to the center, up to that health center. And we are also putting up a maternity ward there. So in this district we have done this hospital, and we are also doing College Health Centre 3. We have learned that projects you cannot do a project alone. You must involve the stakeholders. You must involve the community. You must learn to work with all stakeholders across, from the district leadership, the local leaders around, including the neighbors. So if you want the project to succeed, you must involve these people. If they have local materials that they feel they can sell to the project, we always give them a chance first. So we've learned that projects can succeed well when you work with the communities who own them.
Based on what we've done so far in Sanitary,
yes.
What's your recommendation to the top leadership of the Engineers Brigade?
I just recommend that we continue building capacity. We continue recruiting more people so that we undertake more of this. We get out of health and education and do more projects. Because so far what we have been able to showcase shows that we are committed to quality, we are committed to managing projects within the scope and time. So I encourage our leaders in the army to bring more personnel, buy more equipment to empower us to do more of these works.
Kacumbala Health Centre 4 stands as a testament to Uganda People's Defence Forces Engineers Brigade dedication to quality and timely completion of government projects, as directed by the Commander-in-Chief of Updf and the President of Uganda.
The numbers are overwhelming, the staffing is still low. So that is the other thing we're discussing with the DHO's office, to have us improve and boost up the staffing. This community is a unique community, but we have malaria as one of the topping diseases. Malnutrition is common, but also it's a unique population that we have a lot of TB, tuberculosis. So we have a TB clinic that is running, and currently we have around 10 active clients with around 57 who were contact traced. and there are also ni IPT. And then the other diseases is malnutrition. We have various infections, urinary tract infections, gastritis, and then also we have a lot of teenage pregnancies. So you find teenage pregnancy under theatre because most of them end up being referred for cesarean sections. So with a theatre that is coming in handy, we shall be able to, these people will be able to receive services at their local community. The sexual transmitted diseases, they are also there. And commonly we treat urinary tract infections, cystitis. Others end up with a pyelonephritis. So we really treat a range of various diseases at the facility.
My message to the client is that we thank Ministry of Health and we thank the district of Bukedea for entrusting us to do this project. And I want to say that tomorrow when we hand over this facility to them, I want to request them to maintain this facility. Like, you know, every building deteriorates with time. They should continue making it look nice, take care of it. You know, routine refurbishment should be done so that this facility benefits the population as it is intended.
Last but not least, engineers.
We have already showed our capabilities. You have seen what has happened in Nambole. You have seen what has happened in Entebbe International Airport. That alone should be able to tell you that we are more than ready to take on these heavy tasks if given a chance. Now, my task as a project manager managing the Eastern region is to coordinate with site engineers. Coordinate with site engineers and supervise the works to ensure that we are within the scope of the works, we are within the costs, and we are managing the time aspect very well. So I link the site engineers with the headquarters and then also with our clients, the district leadership, the issues of memorandum of understanding, if there are issues with the MOU, having them fixed so that work goes on without any encumbrances. We have a working office, we have a staff. I'm just a head of that staff. So we are managing because we have quantity surveyors. So if it requires quantification, we task quantity surveyor to do it. We have site engineers who report, they may do monthly reporting. And then we have accountants who help us to coordinate materials from the factory, because those materials we get them from the factories. Like the site engineers prepare requirements from the drawings and the BOQs. They prepare requirements that they require. We compile them and then we submit to the reporter, the factory order. We make an order from the factory. For example, roofings. We need this number of iron bars. They just supply. So I coordinate that in conjunction with our people, our staff. So it is a manageable task.
Kacumbala Health Centre IV has undergone a significant transformation and needs fencing to prevent encroachment and ensure safety of patients and staff.